Alright, in this video we're going to cover the branches of the external carotid artery. Just like we did in another video, we're going to go through it piece by piece. That way you can see how all of them fit together and how that blood flow works from the heart to those areas. Okay, so I've already got the heart pulled up. There's the aorta right there. And we're actually going to go through these branches going up the right side. That way we can see the brachiocephalic as well, then go up the common carotid. So let's go ahead and type that in. So brachiocephalic. Now we're going to do the common carotid. Okay. Then let's go ahead and do the bifurcation. So internal carotid artery on the right side. Now let's go ahead and pull up the external. All right. I think we've seen this before, right? In an earlier video. Now, let's go ahead and start pulling up where these are and what they are. So that first one coming anterior on this side is going to be the superficial or superior, excuse me, thyroid artery. So your thyroid cartilage sitting right there, that superior thyroid artery. Just so you can kind of see those. Then, next on our list, if we're moving upwards, we're going to get a branch coming off the posterior side. This is going to be your ascending pharyngeal artery. Really small. Trying to get to where we can see the, there we go. So we can see that branch coming out. Looks like it's actually coming out posterior and more medial, and then it comes up. All right. Next one on our list should be our lingual artery on the right side. Pretty simple, right? Coming out above that hyoid bone, which makes sense. Then we've got our facial artery. But I'm going to do this other one and it's going to pull it all up for us right here. And we want to see. Perfect. So we've got our facial artery right here, right? and then we start to see where it comes up underneath the mandible right here. Call that the submandibular artery, right? So there's our facial artery right there. Comes back in towards the mandible, back out, and it comes straight up to where it ends at the angular artery right here by the nose. It has a couple more branches right here where your labii should be. Let's go ahead and put those in. There's your superior. And then there's your inferior, right where your lips are. That's where they get their blood supply from. And then we're going to have another branch come off of that. It's going to be your submental artery. So right there, where that mandible is, right before it peaks back out and comes up your cheek, that submental artery rides right underneath that mandible, right on the inside, pops right back out, right in front of that mental foramen. Now, on the next one, it's going to be heading posterior. This is going to be your occipital artery. If I can spell, we should be able to pull it up. There we go. That occipital artery, definitely coming posterior, right above that facial artery. Not very many branches off of that, so we'll go ahead and head to the next one. This should be the maxillary artery. And this is a terminal artery, meaning it's coming to the end of bringing oxygenated blood through, and where it's not going to have any anastomoses with any other arteries. It's going to be the sole provider of that blood. But this maxillary artery, we have two branches coming off of it that we really want to know. We have the buccal artery, which comes down in from the inside of that mandible. It kind of sits right there where all those teeth are. That's going to be right where that muscle is, your buccinator. One of my favorites to look at on this app is your inferior alveolar artery. So this is one that we want to know, but it is hard to see it, right? But we are going to highlight its path here. So we've got our external carotid, maxillary, branches off right, it's going to be before our buccal artery, which we see clear over here. It's going to come down, and right here, this is showing that it's going through our mental foramen, or not our mental foramen, our mandibular foramen, that hole in the mandible that we talked about. Feels like ages ago. It's going to come through, and it's going to supply blood to these teeth on the bottom. Kind of cool, huh? But the next branch of it. It's actually going to come out, and there is our mental artery coming out of the mental foramen. All right, back to this main branch. Right above the maxillary artery, we're going to get our posterior auricular artery. Coming back here to the ears. You can see it right there. That's the external auditory meatus, and the bones of the ear in there. Just putting the last two on there. There we go. So there's your transverse facial. It comes more lateral than your maxillary artery, but branch does come out at a more superior point. And then we have our superficial temporal, and this is going to provide blood flow to all of this side of the head right there, as you can see. So that's it in a nutshell. Yes, we didn't cover all of the branches, but these are some of the major ones. What you should know is that the maxillary, which has the buccal artery and the inferior alveolar artery and the superficial temporal artery, those are terminal arteries, and they're provided their blood flow from the common carotid artery, which then turns into the external carotid. So hopefully this video is helpful. I find it very useful to be able to just piece it together like that and understand that if this is where it's getting blood from, then this is where it's going to go. So hopefully that's helpful, and I'll see you guys in the next video.
All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.